Hello, I'm Eugene O'Malley from Belmont Dental. I'm just here to run through a few tips and hints on how to use your Voyager Free package. One of the modules we're going to deal with now is moving the chair left to right-handed. It's currently in right-handed position, and one of the important things to remember is when you are moving it left-right, that you raise the chair to a higher level. That's our first action. Once we've achieved that, we have the suction manifold, and we need to take the suction manifold off. Underneath, which I'll show you in a further clip, there's actually a turn screw which you undo. You lift the module off, and the easiest way I find is to sit it in the spittoon bowl, and that way it's out of the way. The next step is to move the delivery system all the way around. We're currently right-handed, and we're going to move it round to the left-handed side. Once we get the chair in this position, we're now looking to move the spittoon. On the back of the unit here, which again I'll show you in more detail later, there's a clip that you lift. Once you lift this, you hold on to the spittoon itself and you move the spittoon. When you get halfway, you lift the suction arm over so it doesn't clash, and then you take the spittoon, remember keeping the cut fill spout pointing towards the headrest, and then you point it back this way, and then swing the light round. Once you're in this position, move your delivery system into the left-hand side, take the suction manifold back out, pop it back in the hole, and then tighten the suction manifold back on, and then move around to your right-hand side. And now you're in a truly ambidextrous position. The spittoon will not move without that clip being lifted while you're moving the spittoon. We're just now going to talk about the on-off switch for the chair. 0 below is off, 1 above is on. So once I switch to the 1, I push the button down, you'll see the green light come on. That shows that the chair is actually live and ready to work. On the side of the delivery system, we have the on-off switch here. So this enables us to actually switch on or off the delivery system. So if you're not using the unit, it's best to turn the toggle off. If you are wanting to use the handpiece system, push the toggle over and you'll hear air activating and the system pressurizing. But if you are having a break for lunchtime or weekends at the end of any session, do go back and turn it off. When it comes to changing the water bottle, the toggle here should be switched off. And when you fill the water bottle up, reactivate the toggle. Okay, we're now going to talk about the scaler. The scaler power control is from a potentiometer on the side of the unit here. And you'll see there's a numeric scale here. If you turn it to the right, it's more power to the scaler. Turn it to the left, it's less power. Underneath the unit, you'll see we have these 3 blue dials, and these are the water controls. Basically, this is number 1 handpiece, that's next to the syringe, number 2, and number 3, which is normally your scaler. Turning it to the right will decrease water pressure, turning it to the left will increase. If you want to use the cup fill and you want to put water into the cup, then just depress on the silver button here, as I'm showing you, and that will release water into the cup. The moment your thumb comes off or your finger comes off that button, the water stops. And now we're going to talk about the bowl flush. On the front of the spittoon, again you'll see a blue dial here, and turning on the blue dial will activate the water to the spittoon. If you want to close it off, just turn it to the right and it will shut the water down. Just above the spittoon water control is an indicator, and when the handpiece system is activated and on, there will be a green showing on this indicator, and when the delivery system is off, that will show as it does now without the green. In terms of daily maintenance, it's important to check this filter every day. If you've had a busy morning with lots of crown preps or lots of amalgam removal, it's probably worth doing that at lunchtime, but certainly it needs to be emptied once a day, and this is how it comes. If you press on the yellow stalk that comes out, the filter will pop out like that, and then you can take that away, empty the amalgam into your residue amalgam pot, and then wash out the filter. Just please be aware that when the filter has a tiny mesh on there, and sometimes if the filter's been used too much, you may find a tear in this filter. It's important that you replace that filter if you see a tear, otherwise bone shards or amalgam can bypass that filter. And then you plug it back into the housing. Underneath your chair here, if sometimes your light isn't working from the sensor when you activate it with your hand, there's a switch here, and that's showing manual or sensor. Sometimes cleaners, especially if you've got efficient cleaners, can get underneath and accidentally knock this over into manual mode so that the sensor won't work. So if you find your sensor not working, there's two things it could be. Either this switch is pushed to manual, or the sensor may have a smear layer on there from wiping down, and you just need to use a glasses cloth to clean that sensor off. Underneath the toe board of the chair, there's your plastic cover. When you lift that off, you'll see an air gauge and a water gauge. If you have a problem with your spittoon, the water running on, you can actually turn the spittoon off from this orange on-off switch here. And if you want to drain any moisture that might be in the system that might have come from the compressor, you can open this valve and you'll hear a hissing of air, and any water that's in there that needs to be bled will come out of there. Obviously, if you've got a device for collecting that water, it's a good idea to have it ready and then close it back down after you've finished. If you ever have a problem with your unit, or trying to ascertain its age, or speak to one of your dealers that have supplied you with it, this is the best way of identifying the serial number, SN number here on the back. If you give this number to the dealer or to Belmont, we should be able to ascertain where the unit came from and what year it came from. Okay, we now want to talk about the 300 series LED light. It has a sensor underneath which activates the light on and off. The correct distance for the light to be used is probably about 23 inches, about 1 arm's length away, to get the proper focal distance. If you drag the light in too close, you'll see from the light pattern you get these striations on there, which basically will not be a very true light. So what you need to do is move it back out, and now you can see that's in fully focused position there. It's also sometimes when you're placing a composite or a light cured material, light activated material, you don't want it to set with the light. So if that's the case and you want to work with a material without it curing, if you hold your hand under the sensor and keep it held there, you'll notice that it steps down to 4,300 lux. The light's maximum is 28,000 lux, but obviously this is a white light, so you can still see the color that you're working with, but it won't set that material. And then if you come back, hit the sensor off, sensor back on again, it comes back full. Now you're trying as a dentist or a hygienist to get a balance between the ambient light in the mouth, or the ambient light outside in the surgery, to the light in the oral cavity. So one of the best things to try and do, if you can, is if your room is very bright, keep your light on its brightest position. If the room is not very well lit, from the turn screw here on the back, turn to the left and it will reduce the intensity of the light. Turn to the right, it increases it to its maximum 28,000 lux. So up and down until you get the right balance. It's important, if you don't get this balance correct, then the operator will end up tired between looking from very bright light to a darker outside surgery. That ocular accommodation, moving back and forward between different light zones, can cause great tiredness for the operator, especially by the end of the day. So it's important to get that balance right where you can. Also, please be aware that on the LED light, there are no bulbs to change, so you don't have to touch the unit. The unit has 40,000 hours or 20-year life. Again, to close the light off, you don't want to use it anymore, just hit your sensor and that kills it back. When it comes to programming the chair, it's all done here from the foot switch. Obviously you have the raising of the chair, the lowering of the chair, back up, back down. And let's say we like this position and we want to call this position 1. We basically take our finger or our foot to the 1 button, we hold down on it and keep holding for approximately about 7 seconds, and then you'll hear a long beep. That long beep means now that the chair that's programmed to number 1. 0 is normally your exit position. Number 2 can be your second program position, whether you want to set an X-ray position or whatever, an inspection position. And then LP, and I'll explain that to you, we'll set the chair to come back down. A lot of the times when a dentist is actually treating a patient, sometimes they want the patient to come up and rinse, either while they check the X-ray or have a look at the notes again, and you basically want the patient to take some time out. So if you press LP, the patient will come up to rinse, but you'll notice that the base of the chair is not going up and down, it's stationary, so it hasn't wasted time. If you press the 0 button for the patient to rinse, the back comes up and then the base comes all the way down. There's no need to actually do that. And when you press LP again, it will take you back to exactly the last position that you were at. So you're not messing around resetting the chair each time. So LP, let's call it rinse position if it helps. Number 1 and number 2 program positions, and number 0 for exit. We're just looking at the foot pedal now, and you see there's a blue dot and a yellow dot. With a switch on the blue dot, this activates the water on or the water off to the handpiece. The yellow dot is aimed at, if you select your handpiece, you're working in the patient's mouth and water is coming out and you want to dry the tooth, instead of having to reach for the 3-in-1 syringe, if you press on the yellow button, it activates air through the handpiece and can allow you enough air. It won't over dry, but it'll allow you enough air just to see what's going on, and then crack on straight back on the pedal for normal water and air usage. I just want to talk to you about the placement of the patient in the dental chair. It's quite important that you start from the correct position, and then the patient will be more comfortable during procedure. The first thing to show you is that the armrest itself actually turns out to allow the patient to sit in. I do see, when I go to a lot of surgeries, I see the headrest is in this position and it looks like it has never been moved. It's very important, the taller the patient that you get, that you do extend the headrest and articulate out the headrest pad to make it more comfortable. I'm going to show you with my colleague Patrick in a second what happens to the patient if you allow the headrest to take this position. So Patrick's just going to jump in the chair for me, and then I'm going to bring the chair down to the first recline position. See, the way Patrick has sat in is actually the way, that's fine Patrick, I wanted you to sit badly, because that actually is the way a lot of patients actually do take to the chair. They sit halfway down, and one of the main reasons they sit halfway down is because they worked out their head, to get the head in the headrest pad here comfortably. The human is quite clever and works out that they need to be seated quite a lot further down the chair. So then when I bring this chair down into recline position, what you'll notice is that Patrick is now slipping forward and the headrest is moving away from him. And more than that, you'll notice underneath Patrick's back here, he has no support on the lumbar cushion or the back cushion. So, and his head is nowhere near the headrest. So many of you will be doing this with other dental chairs. You'll ask your patient to slide back up the chair. So Pat, if you slide back up the chair, but by doing that, you still can't get the patient totally comfortable. So mid-procedure, you'll probably find that they ask to stop the chair while they get themselves adjusted. So I'll show you a way that we can actually set the headrest so it makes it easier for Patrick to actually sit in the chair correctly. So I'll bring the chair back up. If Patrick, you exit the chair for me for a second. So basically you're taking the height of the patient, you're working out where their head needs to be. So even setting, if you know the patient's taller, set the headrest up a little bit higher before they actually enter the chair, and articulate here so that you have the headrest pad jutting slightly out. Nobody's spine, or generally adult spines, are not in line with the back of their head. So it's a step forward, which this articulation of the headrest helps. Obviously, if you have a much older patient with curvature, you can get the headrest out to this quite exaggerated position, but it will get the customer or get the patient much more comfortable. Okay, so this is probably the right setting for Pat. So if I ask Pat to sit in the chair now, and one of the important things is while you're sitting the patient in the chair, ask them to slide their bottom back in and then get the headrest pad to meet the back of the head. When I bring the chair back down this time, what we'll notice is that Patrick's in the right start position and he's got full support under his back. So now we don't have to adjust him, and that's very important because you may want to use the double articulated headrest for tipping the patient's head back, and if they're not in the fully extended position to be comfortable, you won't be able to achieve that. If the headrest pad is pushed in, it's very difficult to tip it back. Thank you, Patrick, for that. I'll bring you back up.